This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness
to the
expert
Global
today.
Men's
Wellness Podcast. In this episode, we're exploring a truly cutting-edge development in the world of men's health, one that offers new hope for men with the most difficult-to-treat erectile dysfunction. We often talk about the standard tiers of treatment: pills, then injections, then surgery. But what happens when you're in that last group, the one that has tried pills and injections without success, and you're being told that a penile implant is your only remaining path forward? Today, we are going to examine a fascinating new therapy that could provide another powerful option before that final step: the intracavernous injection of Botox. First, let's set the stage and define who this treatment is for. This isn't for a man who is just starting his journey with ED. This is for men with what we call refractory vasculogenic erectile dysfunction. That means their ED is caused by blood flow issues, and they have already tried and failed to get a sufficient erection using both oral PDE5 inhibitors and standard intracavernous injection therapy, like Trimix. These are the men for whom the current medical algorithm says the next and final stop is a surgical implant. The development of a safe, effective, and long-lasting new option for this specific group is one of the most pressing and unmet needs in sexual medicine today. So, how could Botox, a drug we associate with smoothing wrinkles, possibly work for erectile dysfunction? The mechanism is actually quite elegant. An erection requires the smooth muscles inside the penis to relax, allowing blood to rush in. This relaxation is often prevented by an overactive sympathetic nervous system, which releases neurotransmitters like norepinephrine that keep the vessels constricted. Botox is a neurotoxin that works by blocking the release of these neurotransmitters. By injecting it directly into the penis, the theory is that it can inhibit that constricting signal. It essentially takes the foot off the brake, allowing the smooth muscles to relax and the penile tissues to fill with blood in response to sexual arousal. Animal studies also suggest it may increase the expression of vascular endothelial growth factor, which helps with blood vessel health. Of course, a good theory is one thing, but proof is another. That's why the focus of our discussion today is a specific high-quality medical study published in the journal Andrology. This wasn't just an observational report, it was a prospective, randomized, double-blind, placebo-controlled trial, the most rigorous type of clinical research. The study enrolled 176 men with severe refractory ED. They were randomly assigned to one of three groups: a single intracavernous injection of 100 units of Botox, an injection of 50 units of Botox, or an injection of a saline placebo. The researchers then followed these men for 6 months, tracking their progress with internationally recognized questionnaires like the SHIM score and the erection hardness score, as well as objective measurements of blood flow using penile Doppler ultrasound. So, what did this gold standard study find? The results were statistically significant and clinically very exciting. Both groups of men who received Botox, either 50 or 100 units, experienced significant improvements across all parameters. Their scores on the sexual health questionnaires went up, their erection hardness improved, and their Doppler ultrasound readings showed better blood flow. In stark contrast, the men who received the saline placebo injection experienced no significant improvement at all. The timeline of the effect was also very interesting. The improvements began within 2 weeks of the single injection and reached their maximum effect at the 3-month mark. At this peak, there wasn't a significant difference between the 50-unit and 100-unit doses. Both were working very well. However, as time went on, a difference in durability began to appear. At the 6-month follow-up, the beneficial effects had started to diminish in the 50-unit group, but they remained statistically significant in the 100-unit group. This suggests that the higher dose offers a longer-lasting benefit. Perhaps the most meaningful statistic to come out of the trial is this: around 40% of the men in the Botox groups, men who previously could not have intercourse, were now able to successfully engage in sexual activity. For a patient group that was considered non-responsive to all other non-surgical options, this is a remarkable outcome. Of course, with any new treatment, the question of safety and patient experience is paramount. What's remarkable about this study is how well tolerated the treatment was. The injection itself is a simple, in-office procedure performed by a specialist. Throughout the 6-month follow-up, there were no systemic side effects noted in any of the patients. A few men experienced minor temporary issues like penile pain at the injection site or a small hematoma, which were easily managed. In fact, the researchers noted that the few cases of prolonged erection or priapism that occurred happened during the follow-up Doppler studies when a standard trimix injection was used, suggesting that the Botox may have actually made the penile tissue more sensitive to the effects of other vasoactive agents. So why isn't this treatment widely available yet? This is a very new application of an old drug. This 2021 study is one of the first of its kind, and while the results are incredibly promising, the authors themselves call for more research with longer follow-up periods and in different types of patients, such as men who have had prostate surgery. It's currently considered an off-label use, and it needs to be performed by a specialist experienced in intracavernosal therapy. What this study truly represents is the very essence of personalized urologic care. It identifies a very specific patient, the vasculogenic ED patient who has failed other therapies, and offers a highly targeted, effective new option. It reinforces the idea that we must continue to push the boundaries of medicine. For a man who feels he has run out of options, the idea of a single, safe injection that can restore natural erectile function for 3 to 6 months is not just a medical breakthrough. It's a life-changing one. It restores not just function, but hope, confidence, and the possibility of intimacy. This is the future of treating erectile dysfunction, moving beyond a simple linear treatment path to a world of specialized options that can be tailored to a man's unique
Take control of your
health
needs.
anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.